It's a lot of effort to get our people out. I know that, and it means a lot that y'all came out.
Adam Wyndham is the primary caretaker for his daughter, Emily. She lives with Rett syndrome, needs a wheelchair to get around, and near constant care.
Last year, she actually experienced a code blue event while in the hospital, trying to figure out what was going on with her, where her heart and her brain activity flatlined for a period of time. So her already extraordinary care became even more intensive.
Because Adam is her caretaker, he gets money from the state, but that's set to change. In the new policy, if a family member is on the staff of caretakers, they can't also be the designated representative for the person. The designated representative handles the person's budget and makes decisions.
So then who are we left choosing to be a designated representative?
Wyndham says there are also issues with the program to get funding for essential goods and services.
That service has actually been difficult to use. I personally haven't even used it for my daughter in past years. It takes so much effort and so many multiple medical appointments. Like just this year, trying to get this new chair for Emily, they tried to deny critical parts of this chair.
We landed in self-directed services as a last resort.
Adam wasn't the only parent frustrated with these changes. More than a dozen lined up to speak with us.
They have completely stripped her ability to live her life. Just the basics of getting to places, the basics of help paying for things and all of the things that she needs extra help with.
I love being a part with a DDA, and I really miss that very much.
Some parents are upset their longtime caretakers who have worked with their children for years could be lost, saying the new policy wants to lower their pay.
You can't take someone who's been given a certain amount of money per hour for maybe 4 or 5 years and then all of a sudden tell them that you're going to drop their salary $10 an hour.
Others have trouble getting on the plan.
It's already been difficult to us to find people that have agreed to work with us for Jack, and now they're lowering costs.
Mothers and fathers stressed about what this means when the policy officially changes next week.
I'm freaking out.
We need to stop trying to find ways to add more red tape and accuse parents of wasting money when, quite frankly, I'm saving the state money.
Parents and caretakers are upset about the lack of notice. The policy was announced 2 weeks before the changes take effect. They're also angered their community couldn't provide input. We reached out to the Maryland Department of Health, who said DDA consolidated and clarified policies to improve quality and accessibility for self-directed services based on constituent and advocate feedback, adding that changes will not only help reduce processing delays, but ensure that taxpayer-funded services are delivered in accordance with state and federal regulations. As for family members being able to be decision makers and employed caretakers, the department says that policy has always been that way, adding that the administration is running training programs for families to be able to navigate these changes. The group is still calling on the governor to pause the policy change. In Annapolis, Jeff Morgan, WMAR 2 News.
All right, guys, thanks for watching WMAR 2 News on YouTube. If you enjoyed that story, why not hit that circle and subscribe? We post stories directly from our newscast right here every single day, and you can watch anytime you want.